standing out there holding my phone, trying to cover it with my jacket. And he's like, well, I'll call you right back. I said, no. I'm standing in the rain.
At least I don't have the feather in my hair anymore. Hey, guys. Okay, so we are on our way home from getting Lochlan. Yay! We wanted to make sure that we talked to the vet again before we did the live. There's Mama Debbie. Hi. Before we went and further discussed options. Didn't do anything. It's the service. Reception sucks.
Well, I don't know if anybody else is having problems, but boy, oh boy.
I don't know if anybody else is having problems, but I'll tell you what, we're having. We've been having all kinds of signal issues, no matter where we are. Okay, so he is all bandaged up. He looks fantastic, though, and he's in good spirits. And apparently, he's been eating everything in sight. So
he's good.
So he's good.
Eating and pooping. He's doing
Eating and pooping. And apparently, he made a mess of the stall. They had just cleaned it, and he just trashed the stall.
It's a lot to keep up with.
Yeah. And then he got into the trailer and he pooped. So yeah, he's doing good. Okay, so what they did was after the stop sign. What they did was they debulked it because of the way his leg is. They were not able to remove the full thing, like we had discussed on the other live, but they debulked a bunch of it. Now he's going to go back in a month, and we're going to reevaluate, see if we can debulk more. It is throughout his leg. So the vaccine that they're talking about doing is, and we think it's a good idea. I'll put that out there. We think it's a good idea. It is definitely, it's definitely worth trying for him. What it does is it is made custom for him. They saved a tissue sample to ask us if that is something we wanted to try for him.
And we do.
And what it does is they send it off to a lab. I'll show you guys him. Hang on. And the lab creates a personalized vaccine for him. And what it does is it has these basically markers in it from the tissue sample. And it targets the pathogens in that tissue sample that are causing the mass. And the hope is that it will attack.
Are you going on this side or are you going in?
I'm going in.
You want to go in the man door?
Yeah, I'll just go in. And what? Oh, actually, you know what? I could go into the other door because then it's right there with him.
Yeah. Okay.
I didn't think about it. You know what?
Okay.
You know what? I didn't think about
these clips.
I know they're fun. Anyway, so what it would do is it would attack the pathogens in the mass, and hopefully eat away the mass, and it wouldn't mess with anything else. Oh yay! Oh, here he is, and it's me. Here he is.
I got kisses.
There's his leg.
I got kisses.
Actually, that is lower.
Yeah.
Because he was really swollen up there.
He's got it.
So he's seeped through. So I apologize if you don't do well with blood. He's seeped through. It's going to happen. He's going to have his bandages changed quite frequently the first 2 weeks. Because of where it is and everything. Hello, handsome. You look so good, though. Anita, bad news. He did break his halter. So they zip tied it on.
They zip tied him in.
So he's going to need another halter. Yeah, so they said he did really good. Didn't you, babe? You did really good. And they said he was amazing, super sweet. They just love him.
Yeah, they do.
So what it'll do is we're going to reevaluate him in a month and see if there's any more that can be taken off. But what it would do is the vaccine would target that mass area.
And it's smaller than that is because there's so much wrapping there.
Right. Because they wanted to make sure that it was padded.
Yeah.
And it's got a lot, we have a whole list of instructions on how to wrap it and what we need to use and everything like that. So, if anybody wants to donate to wrappings,
we're gonna need
a lot. Hey, Anita.
Hi,
yeah, he
Anita.
broke his halter.
Yeah.
Yeah, we're gonna need Teflon pads, big, large, extra large Teflon pads, and gauze wrap,
you can't
cotton
come out.
wraps,
You can't come out this door, baby.
cotton wraps, and elasticon and vet wrap and everything like that.
That stuff is really neat.
Yeah, it is. So we've got a whole list of products that we're gonna have
We
to
don't
get.
have anything else to do, okay?
And he's gonna need it changed several times over the next 2 weeks, and then after the 2 weeks, she said he'll let us know how he's feeling and whether or not it's gonna have to, if we're gonna be able to back off on how often we change it. But the vaccine, either one, Anita, either one would be fantastic. We can put up a list of the supplies that's needed, or if you'd want to donate through my Giving Circle, and then we can, or PayPal, Venmo, whatever.
Here we go, bud.
Thank you, Susan. It does. And they said he seemed like, they said it was like the size of a bowling ball, what they took off.
Yeah,
it was the weight.
It
filled the bucket.
Yeah.
They didn't keep the full thing, but they did take a sizable chunk out for the vaccine.
The company can make a vaccine.
Yeah, and what the company will do is they're in a transition time where they are switching over to where they are able to send vets out kits. So basically, they make the vaccine there, and then they make it so that it ships better, and the vets can mix the vaccine so it's fresher. And
It's a fresh one.
It's a fresh one. And then we would go and pick up the vaccine package from them. And here we go, let's turn the heat on.
Oh, look at the mountains.
And
Fuzzy.
they would
It's my eyes.
catch your eyes.
Yeah.
The mountains. It's
See?
storming here again.
It is
misty.
You know,
That's a pretty mountain.
I don't know. People talk about Washington and Oregon having all that rain.
Yeah.
I bet you they're dry.
But so the
Cars in a car.
the vaccine would then come into the vet. They would give it to us, and then we would be able to administer the shots ourselves. Go straight into the muscle. No big deal. Lochlan's really good about vaccines.
He's good at everything.
So he's good at everything. So, and they said that. They said he was just he was amazing throughout the whole thing. So it would be about $2,000 for the series of shots. And they said, in their opinion, both of their opinions, it is the best option we have to try to bring the upper part of his leg down and try to reduce it, because a lot of the mass is inside of his leg. And they
traveled.
can't, yeah, it's traveled. And whether that has been, it's a really stocked up leg because of his injury, because it said in the notes that clearly he has had a trauma, a direct trauma to that area, causing the problem, which would explain the proud flesh, the way that the injury looked, the way his leg looked when he first came, and how it has reacted, all the scar tissue and everything. So that makes sense. So whether it is stocked up really bad, whether it is blocked the entire system,
Flowing
the
of
blood
his
flow,
leg.
the lymphatic, everything, whether CPL has set in, whether the thing is because there's so much, it's really hard to pinpoint
the lab
exactly.
couldn't even
Lab couldn't
absolutely
tell.
100% tell. They tried to give a diagnosis of, yes, it's this.
Yeah.
But it just, they couldn't do it.
So the general opinion is that the vaccine is the best option he has to have a chance at having a normal leg or a more normal leg. There's a good chance that it's not going to cure it completely, not cure, but maintain it and more comfortable for him. And like I said, it would not affect anything else. It just eats away at the mass because it has those markers in the vaccine to target, and because they will use a tissue sample from him that they took during surgery, it's specifically made for him. So it wouldn't work on any other horse. It's kind of neat when you think about it, that they have that technology that they can take and make something custom for him. And they've used it on horses that have sarcoids, before, and they've had great success for it, and that's why they think that he's a good candidate for it. His age is another factor. The fact that he is only around 10 years old. The fact that he does. Oh my gosh, they have electric fence. I was like,
oh
horses.
my gosh, I thought they were just waltzing around.
I got one strand of low electric fence.
Oh my gosh, that's cute.
Ours is cute. Ours would step over it.
They'd laugh first.
They would laugh. But so they've had good success with it in other circumstances, and so they really feel that it is a good chance for him to try to get more normalized in his leg. Oh, that's okay, Susan. Prayers, we appreciate prayers. We do appreciate prayers.
Yep, they go a long way.
They do. Prayers, positive Viking vibes.
Yeah, Viking vibes, get them out there.
Positive thoughts, everything. We really appreciate it. And we don't want anybody to feel like they have to donate, like, you know, or make anybody feel bad about not donating or anything like that, because that's not what we're about. But we appreciate any and all donations. We appreciate any thoughts and prayers and good vibes, any sharing, anything like that. We appreciate it all.
That's a big thing, you know,
and
word of mouth.
We did discuss with the vet, because, and I'm sure they get it a lot, that, you know, people want the miracle cure, and they want the answers now, and they want a definitive. And we told them, we said, that's not us. We realize that the horses we get in, we don't have a history on them. A lot of them have health issues. We don't know all the causes. We don't know, you know, ages have been wrong.
We don't know if
health issues have come.
Inside.
Yeah, we don't know if something has happened that you can't see, you know, on the outside. So our expectations are that we want them happy and as healthy as possible.
Yep.
If healthy means that they are not, like many of ours have had, lymphedema, if that means they have lymphedema where there's no cure, if we can make them happy and healthy in the sense that they are taken care of and maintained, so there's no pain, there's no suffering, that's what we want to do. That's our expectation, not a miracle cure. If we can make them all better, all the better, aces. So, as with this, they weren't able to get rid of it all. But if we can, you know, take that weight off of him, which clearly it has, and clearly it was heavy, all the better. If this vaccine can get rid of more and work from the inside. Lost connection. Here we go. Hi, Jean. Hi, Vera.
Hi, everybody.
Hi, everybody. If the vaccine can take care of even more from the inside out, all the better. And
if we could get that leg to come down the swelling from his hip down,
even a little bit.
We actually noticed he actually has a dip in his leg where they normally, you know, they bend their leg and you've got a dip wherever they've been. He's got one now. Yeah. Which it was just like this balloon, kind of like how I feel when I look in the mirror. And anyway, but now it dips that tuck type of thing. Yeah.
And the thing is we've discussed with the vet too, that Lochlan is going to be a play it as you go, play it by ear. If a situation comes up, we'll discuss it and address it as it comes. Because this is not a typical, she said this isn't something that you see every day. This isn't something that happens all the time. So there's most horses react this way. This is a very unusual, very, a very large situation that has happened over the course of who knows how long he's had this. So it's just like we have the farrier coming out next week. If he feels up to it, he can get his feet done. He's got a couple of chips out, you know, in his feet. If he feels up to it, we'll do it. Otherwise, we will see if on a day he's feeling better, or when he starts feeling better in the next couple weeks, if the farrier can come back out sooner than normal. And it's going to be a play by ear. He may feel up to it. The farrier may do a ground trim. I know not everybody's into ground trimming, but if it helps Lochlan, and it makes it so that his feet are more comfortable, so that his leg is more comfortable, we'll go with that. So he's going to be a we're going to keep
He's
him.
a work in progress.
He is. He's a work in progress. He's always going to be that way. We're always going to, keep an eye on him. And if something comes up, then, we will discuss it with vet to, take care of it.
Because ultimately we have his best, all of them, their best interest.
Yeah, exactly.
It doesn't matter what I may like. Like some people, like you said, don't like the ground trimming. Well, I can see that. I can understand that. However, if this is what works and this is what helps and this is what makes it better, then I've got to say, I don't really like this, but you know what's going to make them feel better?
Yeah. And it's like right now, the bandages are going to be huge. We're not going to be putting any
Normally, a horse would use
in
this
every
much.
sense of the word, the bandages are going to be huge.
And a lot of them.
A lot of them. Because he's going to have it changed right now every 2 days. Unless he, seeps through and he's going to need it done again. So, the Teflon pads, the extra large Teflon pads, and Elasticon, and vet wrap, and cotton rolls.
That's why I said pharmacy.
Pharmacy.
Can I do
Just
a
clear the shelf.
pickup?
But we're not putting any goop on it.
Nope.
To allow the drainage to heal, because right now it's an open wound, to allow it to heal because of what had to be done to it. So this is going to be time healing. A lot of this is going to depend on Lochlan too, his body, how his body responds, how his body feels, how he heals, things like that. So he's going to be on stall rest. We're going to be able to take him out and hand graze him, but only for a short time. He's not to do a lot of walking or anything like that. So, this is long term for him. The vaccine, we're really excited to try that.
Yeah.
Because like I said, if it could even do a little bit to make his life better, we've
done a little. Well, this is crazy. Hello. It's Friday.
He passed on a double yellow. On a hill.
2 more days, it's Sunday.
Semi should not pass people in general,
a semi
but let
coming
alone.
out of horse trailer. I don't know.
Yeah. That's good. We were on the 1-lane bridge, and somebody decided to go at the same time we did on the opposite side.
And I couldn't move over much.
You can't move over on a bridge. So that's the update on that. We're going to.
And we can take we'll have to do a thing and then.
Yeah, we'll have to take a video and then
we can
post
do a
it.
video of him out in the field and
yeah, we're gonna hand walk him in the one field.
Yeah.
Because he can't be turned out.
No, and he can't do the hills.
He can't do the hills. No exertion right now for the next few weeks until he starts. He's going to go back June 19th, and we're going to take Faye in at the same time and have her legs looked at again. So they're going to look at him June 19th and see if there's anything else that can be done for debulking it. Or if it's just going to be a matter of trying to do the vaccine. They'll have more information on the vaccine at that point as far as when the kits will be available. It is going to be about $2,000. I'm actually surprised. We discussed it and we thought Mom couldn't talk yesterday. It was funny.
I'm sorry. It was not funny.
It was funny.
There was nothing funny about it.
So we were talking about it and we thought it was going to be $6,000 to $10,000 for a vaccine, custom made,
that custom thing.
Yeah, and so when he said 2,000, it was like, whoa, really? That's amazing.
Got a coupon?
It's way less than what we were thinking.
Yeah.
So that is something that we would like to fundraise for because we really feel like it is worth trying.
It is. Well, it's detrimental.
Yeah,
it
well,
really
and they did say that. They said that the surgery was absolutely necessary. That he needed to have the surgery done. He needed to have as much of the mask taken off as possible to try to help him. And so they were really, really happy that he got it done. And we were really happy. And we were happy that he stayed the second day. It was needed. And they kept up on the bandages.
Sure that the bleeding was slowing down.
Yeah, they said he could have gone home, but they didn't want, something to happen where all of a sudden his legs started bleeding, and then he was at home, and we had all this blood, and not near them, and need to get him. And we told him, you'd rather have him stay there
Yes.
and have him be looked at, under their care, absolutely. So we were really happy about that. And the vet is very conscientious about that. So we're extremely grateful to them. And they're fantastic there.
They are.
They really are. They're
really
fantastic.
Are. They're good at the communication. Oh my gosh. And if you've got questions, and like me, I can't get the words. What's the word? They just wait. They're very patient.
Yeah.
And
I need a coupon.
Yeah, a coupon. And they're just really great. I really, really like them a lot. And I appreciate all that they do.
Yeah, and they like she said, they answer all questions. So it doesn't matter how ridiculous you think it is or anything. They're just willing to talk about anything. So status quo there for the longest time. She's not laying down as much as she was, but now her legs have kind of taken a turn inward, and so we're thinking that probably because she did have such a growth spurt, she's a lot taller than she was. She's much wider. Good.
It does.
Anita, if bubble wrap was breathable, I absolutely would do it. And yeah, bubble wrap would be a great way to protect his leg. But yeah, so they're both going to come in on the 19th to be reevaluated together, which will make them both happy.